An 18-year-old male presents to the emergency room. He's agitated, breathless, and his heart is racing at a terrifying, unnatural speed. His blood is turning acidic, and the vital electrolytes keeping his cardiac muscle pumping are just vanishing from his bloodstream. He's in the middle of a massive, life-threatening crisis, brought on by a substance that, well, billions of us consume every single day. We're not talking about a rare, exotic toxin here. This is a medical horror story about caffeine. Today in this explainer, we're going to unpack exactly what happens when the human body is pushed past its absolute chemical limits, and how one very unconventional medical intervention brought a patient back from the brink. Let's dive in.
6.0. That's 6.0 grams of caffeine. To put that into perspective for you, your average cup of coffee has about, say, 100 milligrams. The lethal dose for a healthy adult, that's estimated to be between 5 to 10 grams. Our patient ingested exactly 6.0 grams by swallowing 60 tablets of an over-the-counter sleepiness prevention medicine in a suicide attempt. He was staring right down the barrel of a lethal dose of a widely available stimulant, and let me tell you, the terrifying cascade of toxic effects began almost immediately.
The timeline here is incredibly rapid. At 0 minutes, the massive ingestion occurs. Just 80 minutes later, he's transferred to the emergency department complaining of a severe headache and severe nausea. Now, what's really fascinating about this timeline is that after a massive intentional overdose, one of the very first and most violent symptoms is often profound emesis, vomiting. And caffeine-induced vomiting is famously refractory, meaning it stubbornly resists any traditional anti-nausea medications you throw at it. His body recognized a massive chemical threat and was desperately trying to expel it, but it was too late. The caffeine was already flooding his entire system.
His body was reacting violently. Upon arrival, his heart rate was sitting at 139 beats per minute, and that's while simply lying completely still in a hospital bed. His blood pressure had spiked to 152/82, and he was breathing rapidly at about 22 breaths per minute. This wasn't just panic, you guys. This was profound, caffeine-induced sympathetic overactivity. His entire fight-or-flight nervous system had been completely hijacked and cranked up to its absolute maximum capacity.
Inside his chest, it was absolute chaos. The initial EKG reveals what we call sinus tachycardia, that incredibly rapid heart rate we just talked about. But it also shows profound QTc prolongation. Basically, that is a dangerous electrical misfire in the heart's recharge cycle. Massive caffeine overdoses overstimulate the cardiovascular system, causing high blood pressure and jacking up the metabolic demands on the body so much that it starts churning out lactic acid. But this specific EKG abnormality, it was warning the medical team of an even deeper, hidden biochemical crisis.
While the doctors are scrambling to control his airway, breathing, and circulation, they run a blood draw, and the result that comes back for his potassium level is a truly life-threatening 2.6 millimoles per liter. Now, a normal potassium level generally sits between 3.5 and 5.0, so a level of 2.6, that is a literal 5-alarm fire in emergency medicine. It's a critical state requiring immediate intervention before the heart's electrical system just completely short-circuits.
Let's break down exactly what this condition is. Hypokalemia. Hypo meaning low. Cal from kalium, the Latin word for potassium. And emia meaning presence in blood. Low potassium, presence in blood. Potassium is that absolutely vital electrolyte that regulates the resting membrane potential of your cells, especially in your heart. When you don't have enough potassium in your blood, your cardiac cells literally cannot reset properly. This severe lack of potassium can quickly precipitate ventricular tachycardia, which is a rhythm where the lower chambers of the heart beat so fast they just can't pump blood, and eventually asystole, flatline.
Which brings us to the most vital question of this entire explainer. Where did the potassium go? Think about it. The patient was perfectly healthy earlier that day. His body had a totally normal amount of potassium. So did he vomit it all out? Did his kidneys just suddenly excrete all of it into his urine? How exactly does 6.0 grams of caffeine cause a massive sudden depletion of a completely different element in the blood?
To answer that, we have to look at cellular real estate. Under normal, healthy circumstances, 98% of the potassium in your body sits peacefully tucked away inside your cells. Only a tiny, tiny fraction, just 2%, floats freely in the extracellular fluid and the blood. That incredibly delicate balance is exactly what keeps you alive. But in a state of massive caffeine intoxication, that delicate balance is aggressively, violently altered. You see, the caffeine didn't make the potassium leave the patient's body. No, it made the potassium hide.
A vicious cellular cascade was triggered. Step 1, massive caffeine intake floods the brain. Step 2, this causes overwhelming sympathetic nerve stimulation. The body's fight or flight response just goes into absolute overdrive. Step 3,
This massive wave of systemic panic causes profound beta-adrenergic activation, particularly out in the peripheral tissues like skeletal muscle and the heart. And step 4, that beta stimulation acts like a powerful runaway vacuum, forcibly shifting the tiny amount of potassium normally floating in the blood deep into the intracellular spaces.
These complex cellular mechanisms reveal a terrifying trap. The potassium wasn't magically lost from his body. It was driven and trapped intracellularly. The massive caffeine dose augmented the beta-adrenergic action, while simultaneously causing lactic acidosis. The cellular pumps, specifically the sodium-potassium ATPA, just went into overdrive, ruthlessly pulling potassium out of the blood and stuffing it into the cells. This means his total body potassium might have actually been totally fine, but his blood potassium, the crucial part that bathes the heart and keeps it beating in rhythm, was perilously, dangerously depleted.
So you might be thinking, if the blood is dangerously low on potassium, the logical medical response is to just give the patient more potassium, right? Well, standard trauma protocols dictate that a severely low serum potassium level of 2.6 to 2.9 requires a massive 80 milliequivalent intravenous dose of potassium chloride. But right here is the medical horror trap. If the doctors blindly pump 80 milliequivalents of potassium into his blood and then the caffeine finally wears off, all that hidden potassium trapped inside his cells is going to suddenly rush back out into the blood all at once. The blood potassium level would instantly skyrocket, causing fatal hyperkalemia. His heart would literally stop from having too much potassium, entirely due to the treatment.
The doctors needed a way to bring the potassium out of the cells safely without overloading the body. And this leads us to the real aha moment of this case. Instead of aggressively treating the heart directly, or blindly pumping the patient full of raw potassium, they decided to treat the central nervous system to save the heart. They brought in a clever, highly unconventional pharmacological climax to this medical emergency, a sedative called dexmedetomidine. Traditionally, doctors might try using standard beta blockers for a massive caffeine overdose. Beta blockers are sympatholytic drugs. Basically, they block the fight-or-flight response. But they act downstream. They block the receptors way down on the heart and the peripheral arteries. Dexmedetomidine, on the other hand, acts upstream. It acts directly on the central nervous system up in the brain, shutting off the panic signal before it ever even reaches the rest of the body.
Here's exactly how this unconventional intervention works. Dexmedetomidine decreased CMP levels right in the brain. This exerted a powerful sympatholytic effect. Essentially, it was telling the central nervous system to stand down. By stopping the signal right at the source, it completely inhibited the runaway beta action happening all over the rest of the body. And because that beta-adrenergic vacuum was finally turned off, the trapped potassium was allowed to safely leave the cells and restore normal, healthy potassium distribution in the blood.
Because of this incredibly clever upstream intervention in the brain, the doctors completely avoided the deadly trap. They didn't need to give that massive 80 milliequivalent dose of potassium. They only needed to administer a tiny 20 millimole dose. By using the sedative to calm the central nervous system, the patient's very own potassium just gently rushed back out into the blood, exactly as planned. Within just 7 hours, the patient's serum potassium and lactate levels completely normalized.
The final result was a beautifully normalized post-treatment EKG. That chaotic, prolonged rhythm, completely gone. The dexmedetomidine not only restored his potassium distribution, but it brought down his high blood pressure and settled his racing heart rate. The severe agitation and sympathetic overactivity vanished. 12 hours later, the medication was stopped. The patient was totally stabilized, psychiatrically evaluated, and safely discharged just 3 days later without a single lingering physical complication.
This entire case is just a stark, terrifying reminder of the incredible yet incredibly fragile biochemical machinery operating inside us at all times. A common, everyday stimulant, when taken in massive excess, can completely hijack your nervous system, force your vital electrolytes into hiding, and push your heart right to the brink of total collapse. So, the crucial point I want to leave you with today is this. How delicate is the cellular balance keeping your heart beating right now? The next time you reach for an energy drink or pop a caffeine supplement, remember the profound, hidden chemistry you're interacting with. Keep learning, stay curious, and I'll catch you in the next explainer.